viewers, welcome to our channel. This is Health Conscious Team.
Today, we are going to tell you about can young children suffer from acid reflux? Before we start, please like and subscribe to our channel, and hit the bell icon to get new updates. While acid reflux is typically something that adults suffer from, research has shown children can experience it as well. In fact, some infants have been diagnosed with acid reflux when they are only a couple of months old. Most of us are familiar with seeing babies spit up from time to time. If it is occurring on a regular basis, it could be a sign of acid reflux. Most infants are very irritable when they suffer from acid reflux. You may find it extremely difficult to console them. They may suffer from it more when they are lying down too, which is why they could fall to sleep when you rock them on your shoulder. Many parents mistake acid reflux in their infant for colic. The symptoms are quite similar, and most of us don't think of acid reflux and small children together. For most infants, acid reflux is something they outgrow as they get older. Their stomach is then able to digest foods easier. For others though, a doctor will have to run tests to find out what the problem is. They can test the levels of acid that are in the esophagus to give them a good indication. If there is inflammation in the esophagus, medication may be necessary to treat it. As children get older, they are often introduced to a variety of new foods. That is why they can end up developing acid reflux. Certain foods may not sit well with their body. This is especially true when they are consuming spicy foods or even large amounts of fresh fruits with acid in them. They should also drink water each day instead of just sugary juices and sodas. There are plenty of hormonal changes taking place for teenagers, and that can trigger acid reflux for them. It may go away once they get through puberty, but in the meantime, it can be painful and distracting for them. Most teenagers don't have the best eating habits either, and that can further irritate their acid reflux. If they are using drugs or consuming alcohol, then the problem will become chronic for them. More medical professionals out there are aware of how acid reflux can affect children these days. That means you have a better chance of getting the right diagnosis. Parents need to be educated that this can be a problem for their child as well. The symptoms of acid reflux in children can vary, as can the severity of them. Some of the most common ones include pain in the chest, especially when they try to go to sleep. They may complain of burning sensations, a sore throat, pain in their ears, and the inability to get a good night of sleep. Pay attention to these concerns so you can find out if acid reflux is to blame. You want to offer your child relief so they can feel their best and get the rest they need at night. Generally, acid reflux in children can be resolved with over-the-counter medications that neutralize stomach acid. If that isn't effective, a doctor can recommend prescription medications that prevent the acid from being produced in the stomach. Changes in diet and making sure they don't eat meals in the hours before bedtime will also help them to avoid it. So guys, I'm all today. This is just an informative video. Thanks for watching this video. If you like it, please share and subscribe.